where we are done looking at what is making headline. That was in our first segment of the show. And our second segment of the show, it's about the discussion of the day. And what is trending currently today, it's World Cancer Day. The entire world is talking about cancer. There has been a lot in relation to cancer. There are quite a number of cancers that we are having in the country. And Kenya in itself also has not been left aside when we are discussing about cancer in itself. And we need to understand some of the few strides that we've made as a country and as a county here and as a region, particularly coastal region, in handling about matters of cancer. And also in relation, we'll be talking much about cancer care, treatment, what needs to be done, how can we even have interventions in stopping some of these cancers. That is what we'll be discussing in depth here. Also looking forward to the bigger day today, where we'll be also launching a cancer center, where we are expecting also the CS for Health, Mutai Kagwe, will be gracing that event that is being hosted by Governor Hassan Joho, who is the current governor of Mombasa. We'll be having a discussion about the same in just a bit, together with my guest, Nahla Ibrahim. She's already in studio here to shed more light concerning few matters concerning cancer. But as usual, we'd like to extend an invite to you as well. Share your thoughts, share your feedback. How do you feel about our topic of discussion? What are some of your concerns in battling with cancer? If you have ever had an experience of cancer, what can you share with us? Do so. The number is below your screen. Share your comments on all our social media platforms. I believe we are up and running also on Facebook. You can catch us live on Facebook and drop your comment, and we will be sampling your views as we get along with the discussion. But now though, let me introduce my guest to you, Nahla Ibrahim. Good morning.
Good morning, Shadrach.
How are you?
I'm good, thank you.
Yeah.
Thank you very much for having me. Thank you, Boss TV, for having me in such a good forum.
Right.
Yes.
Yeah. And my director had asked me before even, he said before even we get to start, this name Nahla, what does it mean?
Nahla is an Arabic name. It means the first drink of water. Some people also say that it means it's date. You know, date, tende.
Okay, oh, okay.
Yeah. So that's the meaning of my name.
All right. I think his question is answered. Good. Now, if somebody is watching you for the very first time, Nahla, you told me you're a nursing officer. Where do you do your nursing?
I work in Coast General Hospital, Coast Teaching and Referral Hospital, but we opened up new branches. The governor was very keen on these 2 new branches to decongest the main Coast General. So I work in the Chaani branch. We call it Chaani Outreach Center.
Right.
Yes.
How are things like there?
They're quite good. We have our doctors there. We have inpatient services. We have dental services. We have the maternity and child health care, as well as family planning. We have our maternity wing where we do deliveries as well. So, yeah.
Very true. That is in line with devolution, I guess.
Yes.
Good.
Yes.
And we are so happy over the efforts that you're doing around the hospital there. But coming back to our topic of discussion here, everyone today is talking about Cancer Day. How important is this day to you first?
It's very important to us. We need to acknowledge that cancer is real. Yeah, we need to acknowledge that cancer is real and people are suffering out there. So we need everybody to support these patients, and first and foremost, we need to do as much as we can to prevent ourselves from getting this cancer, any type of cancer. So there are things that we have to do as individual and collectively to try and protect us from this killer disease.
Right. And to most people, they will feel like this day is just like any other normal day that we are talking about cancer, simply because it's not the very first time we are having to have a discussion about cancer. People have had cancer quite a lot of time, and yes, they know it's killing, and other they know it's controllable. But the issue here is, of what difference is this year's Cancer Day compared to the others?
Well, particularly here in the Mombasa County, we would like to commend our governor, because this is one thing, there's one thing that he did which we really appreciate, is to open up a cancer regional center. of which so many of our patients suffer, because not many people can afford going to a different county, can afford going to a different country as well. We're talking about county and country for treatment like radiation and surgeries. Okay, we've been doing chemotherapy here and surgeries, but radiation mostly is done in other places, yeah, unless you can afford a private cancer center. So for us, people, for the civilians, for those who cannot afford, for those, as we know, cancer is an economic, it causes economic burden.
Right.
So for those people who cannot afford, can easily access all those treatments in our Coast General Hospital, whereby we are looking forward to the place being open, the regional center, yeah, which is going to offer all those services.
Boss, right, you'll be telling me more about that cancer center that is currently being opened, and also how, of what difference will it bring inside the dealing and fighting against this disease, and going forward, what do you look forward to, you as a person who walks into the medical fraternity in relation to cancer as well? That you'll be explaining me much later. But this day, it's been spoken worldwide to create more emphasis and awareness about cancer in itself, and share more information about cancer and speaking out about it. And my next question would be here, Nahla, when we are talking about cancer, you know, yes, maybe some people have heard of it quite more often, but there is somebody who kind of does not simply understand vividly what cancer is. In a layman's language, maybe you can paint for us a picture about it.
Yeah, so basically cancer is a disease whereby abnormal cells divide uncontrollably. We have cells in our body, we have what we call cells. Cells are things that make up our organs. So these cells are supposed to divide in a systematic manner. But in cancer, they divide uncontrollably, which this division can destroy the organs.
Right.
So basically that's it. The
abnormal division of cells
that destroy our organs. It can occur in any part of the body. The cells can occur in any part of the body. And it may be life-threatening because mostly it's diagnosed at a later stage. So by the time it's diagnosed, it's usually affected the organ plus the surrounding organ.
Right.
Yeah.
And talking about how these cells are being divided inside our bodies, you know, it sounds so complex for most of those who do not understand the medical field. But if Mwananchi needs to know, does it, you know, divide themselves, or we trigger the division in any way?
We do have some predisposing factors which can cause the cancer. Well, which amongst them is older age, it's habits like excessive alcohol.
Older age, like?
Right now cancer is vast. We know that it affects all types of ages, but usually the older ages, like 50 and above,
right,
it tends to be more. Okay. Yeah, it's a much more predisposing factor, mainly because their immunity is low.
Right.
Yeah. So we also have obesity. Well, with obesity, you're prone to so much, and it doesn't leave, cancer doesn't leave obesity behind. We have inherited factors, like if your family has cancer, so you are more prone to getting cancer, meaning that you have to be constant with your checkups.
Is it medical proven, or it's a belief?
It is medically proven, yes.
All right.
Yeah, because what we say, I can go deeper into that. You see, the cancer is basically, it's a bad disease because it affects the genes. Yeah?
Right.
So where do we get our genes?
Definitely.
From our families, right? So that's how we say that it is inherited.
Right. And have you ever heard of people saying cancer is kind of a curse or something, and you know? Oh
yes, yes. We've definitely had our patients who have not accepted their state, like their illness, saying that no, this is not an illness.
Kuna mtu anaendea kwa babu.
Yes. So for those, we really urge them to go for counseling. We do close follow-ups, so we can because we know they're wasting time and we have to start on a treatment schedule, because treatment schedule doesn't just go into a week like we usually do when we get sick. It's like a schedule that you have to like keep going.
Right.
Yeah.
Definitely. And I'm trying to figure out, because yes, I've got to have met people who have undergone their diagnosis of cancer, but in your capacity as a nursing officer, and I do believe you've tried to mingle with some, if somebody today is diagnosed with cancer and all this talk around on how cancer kills, what do you think goes into their mind?
What goes into their mind? Well, before, usually, mostly, the diagnosis is made by a doctor, but once the patient comes for treatment, we deal with these patients because they're usually brought to us for those treatments, yeah? So what we do, mostly we really support them, we give them counseling. So before even continuing, usually the doctors send them for like counseling, they counsel them so they can accept their illness and they can start treatment.
Right. And before even we get into treatment, because it's a broader subtopic that we'll have a discussion about it, I'm trying to look at it from the onset, and at the moment somebody gets himself to feel, yes, I'm told that I've got cancer. How hard can that hit someone?
It can hit very hard, but depending on the also what we call staging, that's we decide on what to do, because we have palliative care, we have hospice care, there's that part of, you know, you have to counsel according to the prognosis of that cancer, the outcome. This cancer, where has it reached? Which stage is it? Yeah. So from there we counsel accordingly. You don't
so
offer
cancer
hope.
has stages.
Yes, it does. You don't offer hope falsely. If it's something that we all know that that death is God's, you know, it's upon God, but everyone is allowed to accept. People are allowed to accept where they're headed to.
Right.
So if it's somebody we know that in 3 months this cancer would have spread and everything will be done, so we give them options. And we encourage them to spend time with their close ones, with their loved ones, as they go peacefully.
Right. True. And for the fact that you've mentioned about stages of cancer here, and to the common mwananchi, this may be tough to them as well to understand. And we normally wait, and you know, if something is not happening in our body, that's when we go to a health center and seek services. And when we are told we have cancer, we start wondering, where did it even start? Is there a need for us to know the stages?
Well, it's good to know. It's always good to know about everything, so that if anything happens and you're being informed that, hey, you have this.
Right.
Because usually, the first thing they do is to tell you that you have cancer of this place.
Right.
Then the stages, you have to undergo more tests. And then later you'll be told that you have such and such a stage of cancer.
Right.
So it's always good to know. So you can also prepare yourself psychologically, you can prepare your family, you can prepare your finances, you know, and prepare for the way forward.
And if somebody is watching and is wondering, do I have to see anything that should make me be suspicious? For instance, and I think I've got cancer of any part of my body. Do we have things that we can look into?
Yes, we have symptoms that we can look into. One of them is, it could be fatigue. Okay, these symptoms, most of the symptoms are related to other diseases. So what we encourage people to do is go for checkups. Okay, you don't just stay at home thinking, oh, I'm just coughing, it's usually my cough. This is usually how I am. Right. Or you have an irregular bowel pattern and you say, oh, this is me, this is me, I've been like this for the past 5 years. So why is that happening? Why is it just you having that and nobody else having that? Right. Okay, So when it comes to skin changes, maybe you've noticed that your skin is darkening. Your skin is persistently becoming yellow. Okay, you have a sore there that is not healing. Okay, my sugar was checked, I'm okay. But the sore is still there, you know, because most of the people think, oh, I have a sore, I have an ulcer, so this could be diabetes. You go and get checked and you're told, oh, your sugar is perfect, so I'm okay. You should go for investigations.
Right.
You should dig and know what caused whatever it is you're having. So the symptoms could be fatigue, it could be skin changes like persistent yellowing, as I said, or darkening of the skin, or redness of the skin, or a sore that is not healing. And we could have weight changes. You could have unintended weight loss. You're not doing anything different, but you're losing weight. Or opposite, you're gaining weight. Right. But you're not doing, you're eating the same.
So if I'm gaining weight today, can I equate that to cancer?
No, unintentional weight gain. Like you've, out of the blue, in a month, you've gained a lot. And your habits are the same. You walk the same. You eat the same. So you have to...
I do exercise the same.
Exactly.
Right.
So you have difficulty in swallowing. And you think that it's a sore throat. Okay, you go, you get treated for the sore throat, week 1, week 2, but it's still there, a month. I got treated. No, you have to like go for further investigations.
Right. Definitely. Ladies and gentlemen, what we are discussing here, it's just to, draw for you that clear picture for you to understand what cancer is, and also some of the few details that you can see for you to maybe suspect that there is cancer or not, and that is what my nursing officer here, she's explaining about. But before even we take a short break here, do you believe this information that you're explaining to me now? Do the public have the same information? Do they understand these all issues, or maybe we are getting them by surprise?
Well, this is why the world at large has come up with these particular days, so that for those who are not aware can also be aware, can be educated. You see, if it wasn't for this day, you wouldn't have hosted the show, would you? Right?
Not right.
Or if it wasn't for so everybody out there is concentrating on this particular day. So this is part and parcel of why we make these days, why these days are created.
Of course. So as we can create more awareness.
Exactly.
Right. And in your facility and at the county level, do you feel there is much creation of awareness about the same?
There is. I can say one of the signs is the opening of the Cancer Regional Center here. Yeah.
Okay.
So that's a good sign, meaning that people are aware, people demanded that, and people were given that.
Right.
Yeah.
Good. Definitely. We'll be coming back to you. And also I need to understand, maybe you've had an experience of meeting somebody who has got cancer. How did she even or he handle it? How difficult is it to know that you're living with abnormal division of cells inside your body, and knowing that maybe to some extent this may not come out so easily, how that experience is, and many more. Also will be tackling deeper into the treatment of itself. It is said that it's quite costly. Why is it even costly? Why don't you guys even lower the prices, think of ways and interventions that can make it easier for people to get the cancer treatment? All those matters and many more, ladies and gentlemen, that you will be sending in. I'll be asking Madam Nursing Officer here, and also talking more concerning the cancer and the World Cancer Day. And she has also mentioned that something will be happening at the county level there. Will be explaining to us also more concerning that, and we will be coming back to discuss more over the cancer care and the Cancer Day at large right here, right now. But we are now taking another short break here. When we come back, we'll be looking at more concerning the few details on the World Cancer Day. Don't go too far.
Boss TV, where inspiration strikes. We are glad you are watching Boss TV. Boss TV, where inspiration strikes.
See, in fact, you are everything I ever wanted in a woman. I think your husband is having an affair.
I'm so fine in this marriage.
See, these things happens in Hollywood movies.
I've discovered that you're a witch.
Why don't you have a single drop of human sympathy?
The fact that I've been polite with you all these years doesn't mean I'm afraid of you.
We better take care to whoever that is responsible for that pregnancy. We don't have a bastard in our family.
I will not be here and allow that useless girl tear my family apart.
Point of correction. I am not abandoning my own family.
What is it? Shh! Frank, you won't sleep with me, your wife in the house. You won't sleep with me in the office. How would you want me to get satisfaction? How would you expect us to have another child?
Don't you know this is not?
Oh, please don't tell me that!
Hello kids, Boss TV is finally here and we are mindful of you. Every Saturday we bring you an educational, inspiring and entertaining kids show known as the Tutus Club.
I am special as I can be. I am special, I am me.
We will showcase amazing kids' talents, fascinating stories, the toughest tongue twisters, and not forgetting the Teen Talk Show.
Baby shark, baby shark, baby shark.
Somebody needs somebody. My body, your body. I'm more check my body. My body, your body. I'm more check my body.
Join me, Joy Kaliche, every Saturday only on Boss TV.
Boss TV, where inspiration strikes.
Tufanye jambo gani ili tujizuie na magonjwa? Ama ni kwa nini tunapata magonjwa? Na je, ungependa kujua mengi zaidi kuhusu magonjwa tofauti na jinsi ya kujizuia? Basi mtazamaji wangu, ungana nami Judy Ngongodi Kiongo ndani ya kipindi cha Jukwaa la Afya Yako. Hapa ndani ya Boss TV, mahali ambapo maswali na maswala yako yote yataweza kutatuliwa na wahudumu wa afya kutoka hapa Pwani. Tegea Jukwaa la Afya Yako.
Straight off the point.
Wazee wa majanga.
Kutaka kumuuliza mzungu mtoto yalia.
The baby is ringing.
Without Blake symptom plexus.
I don't understand it.
Live bro.
Next time.
Ala.
Hawa wanaishi kwa vituko.
Yo.
Ardhi na bifu na mbingu, mbona broko juu? Hii ni kazi ya Mungu, sio babu ama mjukuu.
Hawana majanga ya.
Sasa ni wazee ama visharobaro.
Taka mademu sisi.
Finish. Mambo yao ya kubwaga majanga kila leo.
Kazi yangu mimi ya building and construction.
Building and construction.
Building contractor.
Building and construction.
Hebu ni kucheki.
Building
And construction.
ni mganga. Uganga basi wa kutapeli watu, wa kunyang'anya watu kabisa.
Mbona utapeli?
Kwanza ngoja
Utakuja buti wewe. Sija mtu albadiri hivi kama hao chizi wa crazy.
Sisi ndio wazee wa majanga.
Wazungu sema it's okay.
Yeah, it's okay.
Building and construction.
Exactly. Good night.
Same to you.
The same to you too.
kunifanya mimi mwana kukulala sio? Hivi wewe Heri, wanaona mimi mjinga sana?
Sema ni vile namuonea huruma tu dadako. Lakini siku nikimtia mikononi, wewe mwenyewe utana.
Boss TV, where inspiration strikes.
Right, 20 minutes past 8 a.m. East African time. Ladies and gentlemen, we are on the second part of our discussion now. We've just done our first part of the discussion, and if you missed that, what we were doing is just laying the foundation for you to understand what is cancer, some of the few symptoms that you ought to see, and how you can get yourself to start the diagnosis, walk into a health center, explain your symptoms, do the check-in and the screenings, and thereby you start looking at how you treat yourself. But now we want to look at something else. Welcome back to the second part. When we are talking about cancer in itself here, and you explained to me before we got on set that yes, somebody may see some of these symptoms that you just mentioned, and I don't know, it's arrogance, I don't know, it's lack of knowledge or something, but they do not take a step out from it. How dangerous is it if at all I've seen something and I just assume?
Well, it's actually very dangerous because with cancer, once it's diagnosed early, it can be treated. It can be treated successfully and go into what we call remission, whereby it doesn't affect you anymore. But when you leave it, when you let it progress, it starts spreading around the surrounding body organs and throughout the body. Yeah, so the earlier you get treated, the better chances for you.
Right.
Yes.
True. And also, out from the few predisposing, what did you mention?
I said factors that may, predisposing factors are factors that may lead you to have those, the cancer.
Good. And somebody has just told me, ask whether if there are some kind of feeds or foods that we can eat that can lead to cancer. Because they are told, we hear people saying, do not eat too much on I don't know what that can cause cancer. Is it true?
Well, it is. We always advise people to eat organic food. By organic food, I mean food that is fresh. So all these artificial foods, these candies that we eat, this sugar that we have, because cancer cells, they feed on the sugar, can attribute the cells to change.
Right.
Yes.
So it's true. Food
so
can,
it is. It's actually very true.
Okay. Right. We needed to clear the air on that. And also, yes, we have different types of cancers, and each cancer is treated differently, and each cancer has got its own signs and symptoms and how far it can get.
Yes.
So we'll be looking at two of them that are particularly in your capacity as a nursing officer and also as a woman, talking about cervical cancer and the breast cancer in itself. Now, if we begin here by looking at cervical cancer, it's one of the few cancers that have been mentioned to be killing women. And yes, the country is taking that so serious, being the fact that it's amongst the few cancers that, has it's widespread there. If we are talking about cervical cancer, what are we talking about here?
Cervical cancer is cancer related to the cervix. Okay, and the cervix, as we know, as you know or you don't, is usually it's
I know. Right.
It's the opening. It's the one that opens during birth. You see, like how when a woman delivers, you go to the hospital and you're told, oh, she's 2 centimeters open. She's 3. That is what we call the cervix. Okay, it's the opening that leads to the uterus. So we cannot see the cervix with a woman cannot see her cervix, or she cannot touch it as well. So what is required of women to do is to go to a doctor or a nurse or a health facility whereby they will do a screening, cervical screening, or to do pap smears, or even if it's HPV test, which is also basically a screening test. Yeah, so once we locate, we observe any of those abnormal cells, like I'll tell you in systematically.
Right.
In our facilities, we just do screening, what we call via screening, whereby you insert something that we call speculum to the lady, and we view the cervix. Once we view the cervix, we put the acetic acid, and we let it be there for 1 minute, and we observe abnormal cells. Basically, cervical cancer is caused by HPV.
Right.
HPV is what we call human papilloma virus. There are several types of HPV. Basically, HPV is caused by sexually transmitted infections. And HPV 16 and 18 is what mainly leads to cancer.
Very true.
So what we need to know as civilians, as who we are, is that once HPV is treatable, but if HPV is allowed to stay in the body, it can take up to 10 years and then change into cancer.
Right.
So you can imagine if you get tested and we found HPV cells, we can immediately treat you. And the good thing with that is that we have gadgets that we use to treat you immediately. We do what we call thermal ablation. We burn those cells. We burn those cells, and it just takes about 5 to 10 minutes.
And you're okay.
And you're done.
Right. And my question now is, if, for instance, the women and who are watching us, should they just wake up from their homes and walk into a health facility and say, I've come for cervical cancer screening?
Yes.
Or should I feel something?
Why not? The past 10 days we've been doing an awareness. We did what we call a rapid response initiative, where we advocated for as many women as we could to come for screening. So if
Did they come?
Yeah, we got a good
Were the
number
numbers
of
promising?
Yes, they were. It's not like how, well, I'll give you an example with me. In my facility, usually when I'm stationed in the family planning room, all the mothers who come for family planning, I would encourage them to do the cervical cancer screening. Well, you cannot force somebody, but you explain, and some still refuse. Okay? They still refuse. But after creating so much awareness, and after involving the community health volunteers, and after, putting up posters and everything, then we could get more.
Right. Good.
Yes.
And are we making strides in dealing and fighting cervical cancer? Do you see promising?
Yes, definitely. Like as I said, HPV virus is caused by sexually transmitted infections. So once these women have these viruses and they come to our facility, we've done a cervical screen. We've tested, we've seen the HPV virus on their cervix. We treat them immediately.
Right.
Unless, the only thing that we do not do is if it's already developed into the precancerous form is when we refer them. Now, since we have the regional cancer center facility, we will be referring them there.
Yeah, right.
But otherwise, if it's just the HPV, we have the machines, we liaise with our colleagues at Portrees to do the thermal ablation.
Good. The women who feel like they cannot do the screening, they have given out a number of reasons, some of which, I don't know, myths and misconceptions. I don't know if they are rumors or what, but they say some of the tools that you're using kind of are painful, and it's quite a painful exercise, and you may even affect some of your organs and giving birth, I don't know, fertility issues. How can you clear the air on such matters?
Well, it is uncomfortable. It's not a painful procedure, but the fact remains that since you expose the lady's private parts, everybody gets uncomfortable. But once, with proper counseling and reassurance, they ease up, we insert the gadget, and it's a very quick procedure. It's actually a 1 minute procedure. Can you imagine that?
Right.
1 minute, of which
You know, one doctor's 1 minute, you know.
I haven't spoken about something. 1 minute for 5 years. If there is a, we usually advise we usually recommend mothers to screen for HIV. So for those who are HIV positive, as we know, their immunity is less, so they're prone to develop these infections quite frequently, rather than those who are negative.
Right.
So if you're negative, imagine that 1 minute can lead you to have 5 years of free, being cancer-free, cervical cancer-free. Because once we get tested with HPV, cervical screening for HPV there, and you're HIV positive, the next screening will be after 5 years.
Right.
Only when you're HIV positive, you'll be screened after 1 year. Sorry, if you're negative, you'll be 5 years screened again. If you're positive, 1 year.
Right. Good. So it's 1 minute again as 5 years.
Yeah.
Good. I'm thinking of that analogy that I've come with to try and convince them.
Yeah, we usually tell them like this will make you have 5 years of mind-free cervical cancer.
True. Now, we cannot miss to mention about HPV vaccine when you are mentioning about cervical cancer.
Yes.
And it's one of the few issues that have come out from the HPV vaccine, and there has been a lot. And there's this campaign that mothers and young girls should go and get the vaccine. How far have you gotten with the campaign, and also the issue about people feeling that this vaccine, no way.
So with, first and foremost, I'd like to start with a ratio of percentage that the WHO has come up with, which is 90, 70, 90. We need 90% of girls vaccinated with HPV vaccine by the age of 15 years. We need 70% of women.
By the age of 15 years, meaning 15 years and below?
10 to 15 years, sorry. 10 to 15 years. So from 10 years to 15 years. The reason we're choosing that age is because they're not sexually active. And as we know, HPV is caused by, as I said, sexually transmitted infections. So once they're exposed to sex, you cannot give it because you don't know. You have to now check again and make sure that they're HPV free.
Right.
Yeah, so I went with 90%. 90% of girls 10 to 15 years vaccinated. 70% of women screened for cervical cancer, and 90% treated. Okay? Or it can be treated for the precancerous lesions or the invasive cancer.
Right.
Yeah.
Good. And also, one of the few matters that are coming out of the HPV vaccines, people feel like they equate it to, I don't know, a contraceptive, something like that, family planning.
That's not true. That's not true. It's the same thing with the COVID vaccine. Initially, how many numbers agreed? But look at us now. Personally, in our facility, there's people queuing every day coming for the vaccine, and yet people spoke ill of it. They said you're never going to be vaccinated. It has radioactive rays. The thing is, we have to accept that these vaccinations are here to help us. I'm thinking way before when these vaccinations started, the polio vaccine, initially people thought polio is a curse. But look at us now. We don't have polio. Yeah, so it's the same thing with HPV vaccine.
Right. And even in as much as this is happening, why do you think most people question some of these issues about, why are people fighting science and medicine? Because every time you come up with something, let's say for instance a vaccine, there has been a lot of talk and faulty information out there. Why do you think so? Is it that you guys are not communicating so well? You are not giving out the information or something?
Well, we have to factor in, it's not many people, it's just a few people, and people are entitled to their opinion.
Right.
Yeah, so I don't know what to say to that, but...
Right. Now let's talk a little bit concerning breast cancer also. Is one of the few cancers that are, women are being faced, but also they mentioned that men can also go through breast cancer. Is it true?
Yes, that's very true. Men
Make me understand. How now?
Lumps can grow anywhere, including on the breast of the... Men have breasts, right? But...
Repeat that again.
They have a chest, right? So the cancer cells can grow there. Yeah. So what happens is that men... it can start with a basic lump on that area. and it can grow and become a cancer.
Right. Good. And also, when we're talking about breast cancer, how do you think we should, we as the common mwananchi, we may not understand how we go about the science and the medical part of it. If I see a lump on my chest now, for instance, what kind of steps do I need to take now?
First thing first, you need to go to the doctor. The lump needs to be checked. You need to go to the doctor. They'll maybe require, once you go to the doctor, they'll be able to diagnose. Some lumps are just ordinary lumps. Okay, they might do some blood tests to check. They might do what we call a biopsy, whereby they take a little bit of the tissue from that lump. But before doing all that, they can do a basic ultrasound. An ultrasound can tell us what it is. It could be some pus infection or something inside, you know. It could be just tissue that is accumulated there. So you'll start with a basic maybe ultrasound, depending on what the doctor has felt, and then go to blood test. You then go to a biopsy. Yeah.
Hot water and kitambara, can it help?
If it's a cancer lump, it will not go. It will not go. That lump will remain there every day, despite putting hot water, despite putting Vaseline or any other ointment.
That's what we do in our homes. You find somebody being told, find hot water and salt. You know them, right?
I know.
Good.
We have those.
Right. But also, looking at breast cancer in itself, yes, it's one of the few cancers that we have. And in as much as we are talking about the cervical cancer, this is also one of the killer diseases. And also we've had a lot of intervention from government about the same. If we are talking to the mothers and the men out there who are who are currently facing breast cancer, how can you talk to them about it, and how serious is it also, and how can they find help with that?
Yeah. So for the breast cancer, what we tell people is that every month, I'll start with the ladies, the women. Every month, most likely after your monthly period, menstruation, one is supposed to have a self-check on the breast. By self-check, I mean they're supposed to palpate the breast, to check on the breast using their hands. You imagine that your breast...
You yourself or somebody should do it for you?
Yourself. Self-test yourself first. Once in a month, everyone has to do it themselves, and once in a year, they can go, if it's okay, once in a year, they can go to a facility for a clinical breast exam.
Right.
Okay? So basically, men, women, they're supposed to imagine that the breast, or the right side of the chest is a clock. Starting from 12 o'clock, going round until you complete the circle clockwise. You're supposed to feel for any lumps, feel for any abnormality, feel for anything that is not usual, okay? You look at it, you look at your breast on the mirror, check. When you lift your hands up and down, do they both go up accordingly and down, or is one heavier? Is one staying down and the other one going up? That would indicate that the one that is heavy has something that is not right inside there.
Good.
You look at the skin changes. Is there any skin changes? Is there too much darkening of the skin? Is there dimpling around the breast? Is there any ulcers around the breast? So that should tell, if there's any of those, you just report immediately to a clinical center or a facility for a clinical breast exam, and from there you'll be guided accordingly.
Right, definitely. There are so many questions, especially in the breast cancer, but the timing of the program does not allow me to ask some. But I think I'll have to text you and share some of the concerns, if you understand what I'm saying.
Yeah.
Ladies and gentlemen, now we're undertaking another short break here. When we come back, it's time now to get to see what your feedback is. Finding some of your questions, your feedback, and I'll be asking some of which. There's so many questions coming in, and also I want you to answer one before we even take a short break here. With COVID-19, how has cancer patients been affected most?
Well, COVID-19, cancer patients already are immunosuppressed. So with COVID-19, we urge them to protect themselves even further. Because if they happen to get that, it's going to bring them down totally. So what we do, we advise them to just follow the main protocols, but to be more keen, to not really take things for granted in terms of social distancing, masking up. Yeah, so it's really impacted on these very seriously ill patients, and not just cancer patients, all seriously ill patients, people with different diseases and conditions, diabetes, the heart patients, the patients who are on kidney failure. Yeah.
Right, true. I'll be coming back to ask you some more questions that I see on the number here. Also, ladies and gentlemen, keep your comments coming. Remember, you can also send in your question on our comment section there on Facebook. I'll be sampling your views also as we come back after the commercial break. So kindly, don't go too far.
We are glad you are watching Boss TV. Boss TV, where inspiration strikes.
See, in fact, you are everything I ever wanted in a woman.
I think your husband is having an affair. I'm so fine this marriage too. See, these things happens in Bollywood movies.
I've discovered that you're a witch.
Why don't you have a single drop of human sympathy?
The fact that I've been polite with you all these years doesn't mean I'm afraid of you.
You better take care to whoever that is responsible for that pregnancy. We don't have a bastard in our family.
I will not be here and allow that useless girl tear my family apart.
Point of correction. I am not abandoning my own family.
What is it? Shh! Frank, you won't sleep with me, your wife in the house. You won't sleep with me in the office. How do you want me to get satisfaction? How do you expect us to have another child? How do you think this is not? Oh, please don't tell me that.
Hello kids, Boss TV is finally here and we are mindful of you. Every Saturday we bring you an educational, inspiring and entertaining kids show known as the Tutus Club.
I am special as I can be. I am special, I am me.
We will showcase amazing kids' talents, fascinating stories, the toughest tongue twisters, and not forgetting the Teen Talk Show.
Baby shark, baby shark, baby shark.
Somebody needs somebody. My body, your body. I'm more check up, follow me, my body. My body, your body. I'm more check up, follow me, follow me.
Join me, Joy Kaliche, every Saturday only on Boss TV.
Boss TV, where inspiration strikes.
Tufanye jambo gani ili tujizuie na magonjwa? Ama ni kwa nini tunapata magonjwa? Na je, ungependa kujua mengi zaidi kuhusu magonjwa tofauti na jinsi ya kujizuia? Basi mtazamaji wangu, ungana nami JUDY Ngongodi Kiongo ndani ya kipindi cha Jukwaa la Afya Yako. Papa hapa ndani ya Boss TV, mahali ambapo maswali na maswala yako yote yataweza kutatuliwa na wahudumu wa afya kutoka hapa Pwani. Tegea Jukwaa la Afya Yako.
straight off the point.
Wazee wa majanga.
Kutaka kumuuliza mzungu mtoto yalia.
The baby is ringing.
Without Blake symptom reflexes.
I don't understand it.
Live bro.
Next time.
Ala.
Hawa wanaishi kwa vituko.
Yo.
Ardhi na bifu na mbingu, mbona bro uko juu? Hii ni kazi ya Mungu, sio babu ama mjukuu.
Wayaona majanga ya.
Sasa nyinyi wazee ama visharobaro?
Taka mademu sisi.
Finish.
Mambo yao ya kubwaga majanga kila leo.
Kazi yangu mimi ya building and construction.
Building and construction.
Building contractor.
Building and construction.
Hebu ni kucheki.
Building
and construction.
Ni mganga. Uganga basi wa kutapeli watu, wa kunyang'anya watu kabisa.
Mbona utapeli?
Kwanza ngoja utakuja buti wewe. Sija mtu albadiri hivi kama hao chizi wa crazy. Sisi ndio wazee wa majanga.
Wazungu sema it's okay.
Yeah, it's okay.
Building and construction.
Exactly. Good night.
Same to you.
The same to you too.
Right, ladies and gentlemen, now welcome back to the third part of the show, and we are just in the onset of the finishing. And now it's time to look at some of your feedback. What are you saying, courtesy of our topic of discussion, that is World Cancer Day, and it's been marked worldwide, here in the country as well. Here in the county of Mombasa, something will be happening. In just a bit, we'll be understanding what exactly is happening here. But somebody is asking, why do people with the same cancer get different treatment and have different problems?
Well, people are not, to start with, people are not the same. So what might be good to you is not good to me. There's the allergies. Maybe what I'm allergic to, you're not. So definitely the treatment has to be kind of individualized. There's the general treatment, and then it has to be like custom made specifically for you. Yeah? Because also it depends on the stage. Like a person with a stage 4 cancer, the treatment is not the same as stage 1 cancer. Yes.
Good. And also somebody is asking here about any recent statistics about cancer in Mombasa County.
Well, the statistics are there, and they must be there, but I don't know what statistics exactly the person wants, so I cannot specify. Yeah.
Right. It's quite complex and detailed, and there are so many.
Yeah.
But we will see how that will work out. And somebody also says, good presentation from Nalha here. She's doing a great job. Nice work. I think she knows you. Lazima utatuma salamu baadaye. And somebody asked, at what stage can cancer not be treated?
Well, cancer, at whatever stage, we can treat it in terms of, we can treat at all stages. We try to fight, because as human, you want the best. So, but that, as I say, the treatment is different for different stages. So you cannot give up on a person who is in stage 4, and yet they are willing to fight it. So you'll go on, you'll give the chemotherapy, you can do the radiotherapy to try and shrink the cancer. So it can be treated. Let's not get that wrong. But the thing is, surgery can only be done to the earlier stages. And it also depends on the location. Because if it's in a location that people cannot access, you cannot.
True. And also, somebody asked here, if then you know that cancer is a killer disease, why don't you subsidize its treatment cost?
Well, I'm also looking forward to the regional cancer treatment center opening up, because I'm sure the treatment there will be subsidized. So tell that person to hold on tight. I'm sure something is going to happen.
Right.
But to answer to that, before our cancer center opening, that treatment itself is not cheap. and the machines that they use, the medication that they use, it's not cheap. So let's see what our Minister for Health and
the governor
has in store for us.
And there is a Swahili question here. I hope you're good also in Swahili.
Of course.
Upande wa chakula, kuna chakula special ya watu wa kansa?
Well, chakula lazima tule balanced diet. Balanced diet nini? Ule mboga kiasi, ule kama ni hizi mchele, ule kidogo, lakini mboga nyingi, fruti nyingi. Hizo ndo zinasaidia ku boost immunity yako. So na pia kama nilivyosema, usile chakula hivi vya kutengenezwa kwa mafactory. Lazima ukule chakula vile vyakula vyetu vya kuvuna shambani fresh, ambazo tunajua
tui ni sawa.
Tui si mbaya, lakini sasa tui tuenda kuipika na mafuta because tui ni natural. Sio? Lakini sasa sisi tuenda kuitia elianto, tuenda kutia nini, si ndio? Sukari kwa juu. Hiyo sasa ndio yaja ya athiri ile tui.
Bila shaka. Right. Na kuna mwenzetu mmoja huwa yonywa chai na matunda hapa. Yuko sawa?
Matunda?
Chai na matunda.
Si mbaya, of course yuko sawa. Mapenzi yake.
Right. Now today something will be happening at the county level there. You've just mentioned to me. What exactly is it, and of what impact will it have?
Oh, it's going to have a great impact because our hospital, course teaching in general and referral hospital, it covers a vast number of other hospitals. It's basically our referral hospital in Mombasa, and we've had, as I said, cases of patients who are really suffering, and you see them going away slowly, but there's nothing, and you believe that they can get help with chemo or with chemotherapy, that is medication that you're given, or radiotherapy, that is something like X-ray that is usually given to the patient, that usually they're exposed to, that shrinks the cells, but they can't afford. So with this coming up, as I said, I'm sure it's going to be at a subsidized price, and they can get help, they can get treated. And since it's just right there in the vicinity of the hospital, if it's a surgery to be booked, they can book. It's going to have a wide number of, a good team, because we will have nutritionists involved, we will have counselors involved, we will have the doctors, we will have surgeons, we will have the radiographers. So I think it's one of the best things that has happened in our medicine department, medical department.
In the region? Right, true.
Mombasa County.
Of course. Whatever Nahla here is talking about is the Region Center Treatment Center that is Cancer Treatment Center that is supposed to be officiated and opened by the chief guest, who is Mutahi Kagwe, who is the Cabinet Secretary for Health, and he will be hosted by Governor Hassan Joho, and all eyes and all roads are set at the Coast Referral Hospital in Mombasa County here. Last but not least, if somebody is so happy, she or he has listened to you and I'm very impressed with your presentation and feels like he needs to meet you, where exactly are you situated, and some of your few contacts, if you can allow for them, they can seek advice also medically.
Okay. As I said, I work in Coast General Hospital, Chaani Outreach Center. At the moment, I work in the medical, maternal child health and family planning department. So whoever comes there will just, from Monday to Friday, from 8 o'clock to 4 o'clock.
Right.
Yes.
Very true. I guess so. And also we'll have a discussion later on another day about family planning. Is it a new thing in town? Should people go for it?
Yes, why not? Yes.
Are you going against the biblical whatever?
No.
Tuliambiwa tujaze dunia, and you guys are trying to stop us from doing so.
Sasa ujaze dunia, alafu kesho huna pesa ya kutizama huyo mtoto, huna pesa ya
kila mtu akija na sahani yake.
Sawa, kila mtu akija na sahani yake, na wewe health yako inaendelea kudeteriorate. utazaa watoto 10, 15, you think utaweza kuwalea hao watoto? Nani atawalea? Next thing, wako nje hapo sasa.
Right. So you're in support?
Yes.
We'll find it out another day. Thank you so much for coming through. We do appreciate your time.
For having me.
And of course, we are grateful of the efforts that you're doing as an institution and you in your capacity as a nursing officer. And I guess you'll be also at Coast General today?
Yes,
All right. I guess so. We'll meet there. Ladies and gentlemen, we've come to the end of our show this morning. Thank you so much for your viewing. But remember to catch this episode, the entire conversation, on all our social media platforms, YouTube, Facebook, you'll find it there. And do share your comments and do share the entire clip so as we can get more and more views. But on behalf of everyone who made this program a success, coming to you live from Boss TV headquarters, we'd like to say thank you. Let's do this again next week. Goodbye. Have yourself a nice day.